Okay, so I'm Leslie. This is my informative speech. How's this work? Just the arrow?
Yeah.
Oh, there we go. Okay, cool. To start it, I am an asthmatic, and that kind of sounds scary, but it just really means that I'm one of the millions of people who are suffering with asthma. I live with it every day. And I'm pretty sure many of you in here have asthma as well. And it's really saddening because it's so common, but there's no cure, and there's not really any way to prevent it, but there's millions of causes. According to the National Heart, Lung, Blood, and Blood Institute, there's over 22 million people in America that are suffering, and 6 million of those are children. So I was diagnosed freshman year of high school. I was running the mile. I finished the mile, but I finished with the taste of blood in my mouth, a hard cough. I felt like I was gonna pass out. I felt this pressure on my chest that felt like someone was stepping on me. It was so uncomfortable. I had no idea what was going on. I had never even heard of any of these things happening to anybody. So, you know, I really didn't know what to make of it, and I really didn't even know what to tell anybody what I was feeling. I didn't even know how to describe it. So, asthma is often overlooked. However, that does not make it any less serious or any less fatal. So, kind of going back to my personal experience, a lot of people, I didn't even know what asthma was as a freshman. You know, I didn't have to learn about it. A lot of people don't know about it if you don't have it. So it's really important that we know what asthma is. So that's what I'll be covering first. What are its symptoms and what triggers attacks? And then my second point will be why is it important and how serious is it? And then finally I'll go over what we can do about it, whether we're asthmatic or not. So what is asthma? It's a long-term disease that affects the lungs and the airways in the lungs. Basically what happens is that your airways get irritated and inflamed due to whatever triggers it, whether it's allergens, anything like that. So they get inflamed and irritated, and as you can see in the picture, this is like normal, obviously. This is kind of like how my lungs would look inside, and then while I'm having an asthma attack, you can see that it's tightening up and closing up. So just try imagining trying to breathe through a straw. That's exactly how it feels. Some symptoms are coughing with taste of blood, as I mentioned before, chest tightness. Wheezing is a really nasty noise that you hear. It like literally sounds like your throat is making a whistling noise. It's very uncomfortable. So what triggers asthma attacks? Basically, every single asthmatic is a little different from the next. Different triggers like cause different asthma attacks for different people. So for me, cold weather does it really bad. Pet dander, allergies, I have bad allergies. Another common form of asthma is exercise-induced asthma, and that occurs due to physical activity. And that's kind of how mine started, since I had just finished running the mile, and that's when I had my asthma attack. And doctors really don't know why physical activity conflicts with asthma. Like, they can't really tell why it happens, why you get asthma attacks. And so a third trigger actually can be emotions. Dr. Abraham Stern wrote in his book, Asthma and Emotions, that experiencing strong emotional feelings, the endocrine balance can change as a result of the hormones. Basically meaning, if your emotions are out of control, the rest of your body reacts to it the same way, and it could come out with asthma attacks. And especially if you have allergies as well, it kind of just double trouble, you know? So it's kind of like a physiological response, kind of like right now when all of you come up here to do your speech, your heart starts pounding, your stomach turns, you shake. So sometimes you can have difficulty breathing as well, so asthma can get triggered by that. So what about treatment? Treatment depends on the severity of the asthma, but usually every single asthmatic gets 2 types of inhalers. There's the quick relief inhaler, which is usually albuterol is the medical term, and it's quick relief. So once you take this, basically you take 2 puffs. You're supposed to wait a minute in between puffs, but sometimes you don't have time to do that. So it's an emergency relief inhaler. So basically it opens up your lungs just this like, really quick. And then there's a long-term inhaler, which is like basically steroid inhaler. And you're supposed to take this twice a day, 2 puffs a day. That just basically minimizes asthma attacks, makes them more mild, more controlled. And there's always a but. Asthma can be super basic, but then also there is severe there's severe asthma. So there's people who are severe asthmatics, and that just means these don't work for them. So they have to go to an extra step to control their asthma. And 5% of the 22 million suffering with asthma are dealing with severe asthma. So now we can move on to why should we take it so seriously. Asthma can be deadly. Okay, so in 2009, 3,388 people died from asthma attacks, and the statistic is from the Ascencio for Disease Control. And since it was in 2009, you can just imagine that it's gotten worse. You know, so one reason why it could be so fatal is the fact that your brain needs oxygen. I remember when I was first dealing with my asthma, I would get constant headaches after I'd get my asthma attacks, and after I'd inhale everything, my head would hurt. And I would tell my doctor that, and my doctor told me that it's because not enough oxygen was getting to my brain. So I would feel lightheaded, and that would be the headache, which could cause unconsciousness, so you don't want to pass out. And then also, what's more of a concern is when you're having an asthma attack, your bronchial tube spasm. So if someone's having constant attacks and is not controlled, the air sacs lose elasticity. So because of that, you don't want them to lose elasticity, because if there's no elasticity, then the lungs can remain permanently inflated. So like elasticity allows your lungs to breathe in and out, so inspiration and expiration. Remember, they're fatal and they're dangerous, and now we can go on to the final point. What can we do about something that is not curable, not preventable, and something that can be fatal? It sounds like we can't do anything about it. So there's no cure, no real cause. It can be controlled, which is a good thing, but mostly what we have to do is just live with it and avoid triggers. So what if the inevitable happens and you're with somebody who is having an asthma attack? Like, what if I just started having an asthma attack right now? You know, what are you gonna do? A lot of people don't know what to do. So number one thing is reassure them, tell them everything's gonna be okay. Take them away from any triggers. If there's someone smoking a cigarette outside, take them into a room where it's closed. You know, make sure they're taking deep breaths, that's key. In with the nose, out with the mouth, kind of like when you're running. If the person's having issues or they don't remember what to do, just ask them where their inhaler is, try to help them use it. If they're having a panic attack, I know I tend to get panic attacks when I have my asthma attacks. So what really helps me out, and what is just a great way to help with panic attacks, is hold the person tight and make sure they're listening to you breathe. So tell them to follow your breathing. So just, you know, like say in, out, and like have them follow your chest, you know, so just so they could control their breathing without, if the inhaler fails to, what's the word? Yeah, if it fails, like if it doesn't work, or if they just can't stop. So now we can conclude. It's important, I first stated that it's important that you all familiarize yourselves with how severe this disease could be. You know, I explained to you what asthma was, its symptoms, its triggers, just so you guys can all be aware. Secondly, it's important to recognize the severity. Don't take it lightly. It's something that is underestimated. And third, I told you guys what you guys can do about it if you're ever in the circumstance. We have to educate ourselves, most importantly, support asthmatics to keep continuing their medications. If they need more help, to go seek doctors, to seek more professional help, and then encourage care towards those suffering. Like, just don't take it lightly. It really sucks. Just not being able to breathe, almost suffocating, is just not fun. Thank you. Breathe safe. Are there any questions? Okay, cool. Thank you.